Hi, this is Erica Grotto from HFMA. I'm here at HFMA's annual conference in Nashville. Very excited to be joined here today by Mo Whitenauer, Chief Product Officer at MRO. Hi, Mo.
Hi, Erica.
So let's talk about what are some of the trends you're seeing right now with health plan requests for clinical data?
Sure, great question. So we're seeing a lot of trends, but the primary one that's really affecting health systems is around the volume of clinical record requests. So there's just been an increase of record requests. We're seeing, for example, in our own data, about a 35% increase just this year in payer requests, even after COVID. And that's driven by several things. So first, we're seeing more demand for risk adjustment requests with more seniors aging out, and joining the Medicare Advantage program. We're seeing a whole lot more requests for their data to be seen by payers so that they can ensure premium accuracy for that program. Secondly, we're also seeing a lot other types of requesters coming into play. So we're seeing life sciences requesters, more payment integrity or audit requests, both prepay and postpay. We're also seeing more patients and continuity of care requests coming across the board. The other piece here with the increase is that CMS has mandated through this 21st Centuries Act for more data sharing. So there's much more incentive across all players in the industry to share data with each other, which means that we just have more providers who have to provide data across the ecosystem, and we're here to help them. And then lastly, just more complexity of the types of requests that are coming. So we have patients who rightfully have really taken charge of their own healthcare data and are requesting different types of things to not be shared with payers or to not be shared with other players. So if you think about reproductive health, if you think about things like gender, just some types of sensitive data to be held back on behalf of the provider. Providers themselves are just becoming much more aware of the need to be more specific in the types of data that they're sharing, and that's really the business that MRO is in.
What do you think are the challenges that health systems are facing as these demands grow? What do you think is the potential financial impact of that?
So health systems, even in a post-COVID world, we've seen just razor-thin margins that CFOs have to deal with. So Kaufman Hall just released their May flash report showing that health systems are operating at zero margin. So there's really not a whole lot that the CFO has room for to invest in things like patient care, patient access, and other things that are needed. And so this is really exacerbated in the sense of, we're having labor shortages. So when you have demand increase, so for example, risk adjustment and HEDIS is very seasonal. And so you imagine your health system, you have an increase in volume, you have to release all these records, but you just can't find the people to go work the records. And that's really where companies like MRO, we step in. The other piece here is just the growth in cost for just running the regular operations in the health system. And that makes it much more difficult for them to operate with those razor-thin margins.
So let's talk about solutions. What kind of solutions does MRO have to help address some of these really big challenges?
Sure. So MRO, we've been around for over 20 years. Our business is to partner with health systems and help them address all of these challenges. We're launching a brand new product. It's called Payer Exchange, and it is a fully digital clinical data exchange solution that is zero to minimal touch of the medical record. We get the request from a payer, or it could be another company, through an API. And then we use FHIR API, which is the standard for clinical data exchange, to extract that record from the EHR, and then we ship it to the requester as needed. We provide full visibility to the providers so that they see where are all these records going, who's asking for the most records, for what purpose, and how does the record affect my bottom line. So we're providing that 360 view of where the records are going. In addition, one of our biggest business models that we're proud of is that we actually share our revenue with the provider. That when our clients grow, we grow, and we want to share in that wealth with them. And then lastly, we know that it's very important to have high integrity of the data. So we're doing this at scale while we're maintaining just high integrity, high accuracy of the data so that the data don't end up in the wrong hands. Nobody wants their clinical data to end up in the wrong hands, and that's what we're in the business of.
Wonderful. Well, I really look forward to hearing more about how your new product does. I'd love to hear some results when you're ready to share them.
We will be ready to do so. Yeah,
wonderful.
We're very excited.
Wonderful. Well, Mo, thank you so much for joining me today.
Thank you. Thanks for having me.